provider of this big toe. And unfortunately what resulted was this big toe is going that way and it's rubbing across this second toe, and it's causing a lot of pain with a callus to this part of this toe and then this part of this toe. So what we're gonna do today is we're gonna do minimally invasive surgery to bring this toe this way so that it's no longer touching this toe. And we're gonna be here in the operating room in a couple minutes. And again, this is just gonna be a very, very small incision right here. No hardware, no screws, all under local anesthesia, all done in the office procedure suite. And we'll keep on showing you how this goes. So here we have the drill inserted into, or the burr inserted into the bone. You can see the small incision. And on the x-ray, you can see right where the burr is going into the bone. And what we're gonna do here is we're just gonna take a small little wedge of bone, and the wedge is gonna be medially, and that's gonna allow me to rotate the toe to the outside, to the inside, and take the big toe off of the second toe. You doing okay there, my dear?
I am fine, Dr. Speer. Thanks for asking.
Oh, yes, ma'am. So you can tell the patient is awake. Just straight local anesthesia. So now we've created a little bit of a wedge on this foot, and we're going to revise it some, but now when I take the x-ray, you'll see this bone cut right here. And this will allow me to hinge the toe like this, and this will close down. And now it is no longer abutting the second toe. So before the bone cut, the foot was like this, where it was touching the second toe. And now when we close down that wedge of bone with that cut, it'll now look like that, where it's no longer touching the second toe that's next to it, and get rid of that painful callus on those two toes. So here we have a patient here, and she is exactly 1 week out from surgery, and we did minimally invasive surgery here. We have little incision here, little incision there. This swelling is normal. This bruising is normal. This looks great. Okay. I mean, the amount of separation we have now between this toe and this toe is phenomenal. How have you been since surgery?
Good.
Good.
Good. Minimal pain at first. I took only one of the narcotics, and that was it. Tylenol extra strength worked well.
When you come back in a week, these sutures will come out.
Okay.
I'm going to put a dressing back on your foot today. Everything stays the same. You can continue to walk on it and drive. Toes can stay swollen for a little while, but with this type of surgery, usually about the second to third week, it's gone.
Okay. So 6 weeks I do wear the shoe, right? 6 weeks?
Oh, you'll be in there before then.
Thank you.
Yeah, you'll be in the shoe before then.
Good.
Looks
That's
great.
all, doctor. Thank you so much.
Yes, ma'am. So we are now 6 weeks out from minimally invasive surgery. And what we had here is before surgery, this toe, the big toe, was going in that direction, and it was rubbing across this second toe, causing a really painful callus. And you can see we just had one little stitch right here and one little stitch here that allowed the toe to swing over. Callus was gone even before the first post-operative visit, but at 6 weeks, I still don't see any recurrence of that callus. How have you been in the past 6 weeks since surgery? How have things come along for you?
Today it is truly wonderful. At first, it was a little pain with it, not much at all. Tylenol extra strength took care of that. Nothing stronger. It was a little slow process coming along, but the laser really did help. The laser, I think, really helped. And other than that, it's turned out so much more than I thought it was going to be. It turned out wonderful. I'm pleased with it, by all means.
And let me poke on it. Any pain in here?
Not at all, doctor.
Any pain in here?
Not at all.
Can you wiggle, wiggle, wiggle? You got
Wiggle.
great range of motion. That's what I'm really happy about. This is good range of motion.
Mm-hmm.
Fantastic. And those toes are no longer kissing one another.
That's right.
You're going to do awesome.
We are doing good.
All right. Well, we're going to cut you loose for a month and we'll see you back in a month.
I'll be back. Thank you, Dr. Speer.
Oh, my pleasure.